Imagine going to a clinic and finding it completely out of the most basic medical supplies, and the doctors unable to give you the treatment you desperately need. That's exactly what you'd have to deal with in many poor countries, but a Calgary couple is trying to change that. As Gil Tucker reports, they'll soon be leaving Canada on a medical mercy mission. They're putting their spirit of Calgary to work, helping patients thousands of kilometers away.
We'll take pills like this because there are quite a few pills. They're nicely packed.
When you get Myron Semkouli to show you around his house, it's almost like a tour through a medical supply warehouse.
Needles, syringes, bandages.
These are used by asthmatics. These are puffers.
Myron and his wife Elaine are getting ready to head off once again to help people on the other side of the world. They'll be trekking down this trail in Thailand in a couple of months, heading to a remote clinic for the thousands of Burmese refugees in the area.
There are pregnant ladies running across the border. There are sick children, a very high incidence of malaria. Some of them have been wounded either by gunshot from the Burmese army or by stepping on things barefoot in the jungle. They're in a bad way and they have nothing.
And then a few weeks after they get back from Thailand, they make their annual trip to Ukraine, another place where people are desperate for medical care.
We walked into the clinics and the nurses would say, please, just send us some gauze. Just gauze. We haven't had any gauze for 2 years in this clinic, they would say. Not an instrument, no stethoscope, no blood pressure measuring machine, nothing. Medicine for arthritis.
This will be their 10th year going into those two countries, helping thousands who might not get any care without their medical mercy mission.
We're trying to show that there are people that care.
Now, a lot of these medical supplies, they're saving from local landfills, things that would have been thrown out otherwise, syringes from doctors who are retiring, instruments that hospitals don't need anymore.
These packages are unopened, still very sterile, excellent. They just cry for things like this in the small country hospitals in Ukraine. There's creams and lotions.
They're overseas 3 months a year, spending thousands of dollars and countless hours on the project throughout the year, somehow fitting it in around Myron's practice as a family doctor here in Calgary.
We both feel that it's a privilege to be able to share our good fortune with those that are much less fortunate.
Gil Tucker, Global News.
Aren't they great? Good for them. And if you would like to help out, you can give them a call at Medical Mercy Canada, 251-1300. For people with kidney failure, dialysis